Hello everyone. Let's wait for Dr. Pishwani to join us today and then we'll start with it. So we are here with various health discussions. In today's time, people are actually very curious what to do about their health, and there are a lot of issues which we want to discuss, but we don't know with whom to. So we, as Homeo Amigo, we have come up with these sessions wherein you can speak to your doctors, and every day we are going to bring doctors who will discuss about your issues, and we'll have different topics. You can also suggest the topics you want to discuss with your doctor, and we can bring doctors for those particular topics. So in the meanwhile, doctor, join us. You can share the various topics you want to discuss. I'm waiting for the various topics you all want to know from our doctor. Thank you, Mr. Arijit. Yeah, it is definitely very interesting to have doctors every day with us. I think our doctor is here. She's just joining in a moment. Yeah, she's here. Hi, Dr. Pishwani. Dr. Pishwani is with us. She is a homeopathic consultant at Homeo Amigo in our Mayuviha branch. She's today here. So today we are going to discuss on asthma. Asthma for adults as well as for kids. So Dr. Pishwani, before we start anything, kindly let us know about what is asthma actually.
So asthma is a obstructive disease जिसमें आपकी जो air spaces हो जाती हैं, they get narrowed and that causes difficulty in breathing and chest tightness.
Especially in case of asthma, we'll do that. I would request one of my team members to please connect with Dr. Pishwani so that she can join us back.
Hello.
Hi, Dr. Pishwani. We lost you because of poor connection, I guess.
Yeah.
Yeah. So you were telling us about the asthma. So what is it exactly?
So asthma is basically narrowing of air spaces जिसमें for trigger की वजह से आपकी जो air spaces हो जाती हैं वो narrow हो जाती हैं and it causes difficulty in breathing and cough for longer period of time.
Okay. Doctor, I would request you to be a little louder. Your voice is not coming very clear. Okay. So, what are the common symptoms of asthma which we face?
So the
Yeah,
common
mask is a
symptoms
necessity nowadays. So, what are the common symptoms, doctor?
Common symptoms that you can experience are chest tightness and breathlessness even after small physical activity. Okay. Bouts of
Mm-hmm.
cough and wheezing when you exhale are very common symptoms.
Mm-hmm.
And even after
Okay,
slightest
fine.
activity, if
And
you're feeling out of
Okay. So is it common in case of both kids and adults, or is there any difference in the symptoms?
In adults, you can find more of wheezing when you are exhaling, and in kids, yeah.
Anshu is asking, is it safe to exercise with asthma?
So in olden days there was a myth कि आप asthma के साथ exercise नहीं कर सकते, but you should definitely have slight physical activity, so it will strengthen your lung muscles, and so slight physical
Mm-hmm.
activity is very important even in asthmatic patients.
Mm-hmm. Okay. And how can we protect our kids during this pandemic from asthma?
So kids who are suffering with asthma should restrict from going outside, and if it is very necessary, they should always wear a mask and maintain a safe distance from people. They should increase their immunity
Mm-hmm.
because it will only protect them from COVID. Their
Mm-hmm.
immunity will only protect them from COVID, and if it is very necessary, then only step out of your house.
Okay, fine. So by this way, we can protect our kids. I hope, like for the people who are curious about the kids' health, they've got the answer. Anything else you want to ask about the precautions on the kids? In the meantime, I'll ask about other things to Dr. Pishwani, and you can keep on giving me questions as well. So, doctor, another question is asthma a chronic disease?
Yeah, it is a chronic disease. If you are taking
Mm-hmm.
homeopathic medication in initial stage of your disease, it can be permanently cured. Otherwise, you have to take inhalers and allopathic
Mm-hmm.
medicines
Okay.
for a longer time.
And homeopathy has treatment for asthma. Can it be cured permanently with homeopathy?
Yes, definitely. Homeopathy has treatment for asthma. There are certain medicines which will help in breathlessness and cough. And if you're taking homeopathic medication in initial stages, it will definitely permanently cure your disease, making physical changes which
Okay. And
are difficult to reverse.
okay. And can I get rid of inhalers if I switch to homeopathy? So क्या मुझे उनसे छुटकारा मिल सकता है? Because that is something मतलब asthma people do need to carry.
So that's what I said right now कि अगर आपका pathological changes आपकी body में आ गए हैं, so you have to take inhalers. लेकिन अगर आपने initial stages पे treatment start कर दिया है, then definitely you can get rid of inhalers.
ओके फाइन सो अगर हम टाइमली बेसिकली द की इज कि अगर आप टाइमली स्टार्ट कर देते हैं ट्रीटमेंट देन डेफिनेटली वी कैन गेट रिड ऑफ द इनहेलर्स एंड मे बी शायद उनकी जरूरत ही ना पड़े अगर हम इनिशियल टाइम
हाँ,
पे स्टार्ट कर दें तो डॉक्टर
अगर आप
यूजुअली
initial stage
होम्योपैथ
अगर आप
सो
initial
आई वाज
stages
सेइंग कि
पे
यूजुअली
start
आई एम सॉरी डॉक्टर आप यू कंप्लीट या
it's okay. अगर आप initial stages पे treatment start कर देंगे with homeopathy, then you will not even need inhalers and allopathic medicines.
ओह नाइस दैट्स ग्रेट सो बट डॉक्टर बिकॉज एक कॉमन एक नोशन है कि अगर मैं होम्योपैथी लेता हूँ सो इट इज अ स्लो ट्रीटमेंट एंड इट इज अ लॉन्ग टर्म ट्रीटमेंट और पता नहीं ट्रीटमेंट होगा भी कि नहीं होगा सो इज इट लाइक दैट कि बहुत स्लो ट्रीटमेंट होता है इन होम्योपैथी
दिस इज अ मिथ कि स्लो ट्रीटमेंट होता है. एक्चुअली क्रॉनिक डिजीज इज अ लॉन्गर कोर्स होता है उसमें. इफ यू आर टेकिंग ट्रीटमेंट
ओके
इन एन एक्यूट डिजीज, अगर आपको सिर्फ खांसी है अभी 2-3 दिन से, इट विल गेट यू विल गेट रिलीफ इन इवन 1 डे. अगर आपकी
सो
डिजीज क्रॉनिक है, देन इट विल टेक सम टाइम, जिसमें आपको मेडिसिन को एक्ट करने में थोड़ा टाइम लगेगा.
सो बेसिकली अगर इनिशियल स्टेजेस पे मैं आ जाऊं तो डेफिनेटली इट कैन बी ट्रीटेड वेल इन टाइम बट अगर मैं अपनी बीमारी को बहुत सालों तक उसको क्रॉनिक बना लूंगी तो डेफिनेटली उसको जाने में भी थोड़ा तो टाइम लगेगा बट इट डेफिनेटली कैन बी
Definitely, yeah.
So, डॉक्टर पायश्वनी, वन मोर थिंग अबाउट होम्योपैथी जो ये लगता है कि मैं क्या मतलब किस तरह की दवाइयाँ होंगी, सब सारी दवाइयाँ एक जैसी लगती हैं, तो ऐसा मतलब डिफरेंस होता है, एंड हाउ कैन आई ट्रस्ट दोज मेडिसिन बिकॉज सब एक जैसा होता है, एंड व्हाट इज द डिफरेंस इन दोज एंड हाउ इफेक्टिव दे आर?
So all the medicines in homeopathy are made from alcohol, so they look the same, but they are made from different raw drugs. हम रॉ ड्रग्स से पोटेंटाइज करके डिफरेंट मेडिसिन बनाते हैं एंड वी एट होम्योमीगो डू नॉट डिस्पेंस इट इन मीठी गोली और वाइट ग्लोब्यूल्स वी गिव यू सील पैक मेडिसिन सो यू हैव द नेम ऑफ द मेडिसिन
Okay.
सो यू नो कि आप कौन सी मेडिसिन ले रहे हैं.
Oh, that is great. That is wonderful. And doctor, there is one
Hello.
Dr. Pishwani.
Can you repeat the question?
Yeah. So the question was, would the mask help the asthma patient during this season?
Yeah, definitely. If they are stepping outside of their house, it is very necessary. You should always wear a mask, and
Mm-hmm.
I think it's better if you have an N95 mask, and always carry a sanitizer and a mask with you.
Are asthma patients more prone to this disease, or is it like because of this disease affects the respiratory system, they are more so it is more dangerous for them? What exactly it is?
So it is not that ki asthma patients are more prone. They have lowered their defense barriers and their immunity. So, and it is also a respiratory disease. COVID-19 affects your respiratory system, and asthma also affects your respiratory system. So it is more dangerous कि
Mm-hmm.
अगर आपकी रेस्पिरेट ब्रेथलेसनेस हो रही है, कफ हो रहा है, ये प्रॉब्लम होती है. वैसे दे आर नॉट मोर प्रो बिकॉज ऑफ द लोअर्ड इम्यूनिटी. इट कोविड-19 ज्यादा डेंजरस है एस्थमा पेशेंट्स में.
Okay, so in homeopathy as well, तो क्या वो immunity boosters will be effective on asthma patients also?
Definitely, immunity boosters are effective. Like we have immunity boosters like arsenic album 30 and agonal. They are
Mm-hmm.
effective in
Mm-hmm.
even in asthma patients. They asthma patients can take, and I have given, and they have wonderful results.
Oh, nice. So, doctor, one more question here is that is it a genetic disease, and the common symptoms during the start of disease? What are the common symptoms during the start of this disease?
So it can be genetic also, but if you have to identify the trigger factor, what is triggering your asthma?
Okay.
So the most common
Okay.
symptom is chest tightness and breathlessness.
Mm-hmm.
Even with small
Okay.
physical activity, yeah, there is tightness and breathlessness. This is the first thing you
Okay.
have to identify.
Okay. And does stress trigger asthma?
Definitely, in some people, if it is very matlab, mental stress or physical stress, it triggers asthma.
Okay. And any specific precautions for asthmatic patients during the third wave?
That's just I said कि आप बिल्कुल घर से बाहर ना निकले. If it is very necessary, always wear a mask and carry a sanitizer and maintain a safe distance
Mm-hmm.
from other person. Because we don't know
Okay.
कि
And
which person is suffering from COVID.
okay. And doctor, one more person is asking: is homeopathic treatment safe? And does it take too long? The thing which I
And it does not.
shall I repeat the question, doctor?
Can you repeat the question?
Uh, yeah, sure, doctor. So I was saying that there's somebody who's asking: is homeopathic treatment safe? And does another question added
Yeah,
to it is the same, that is it, does it take too long to recover?
homeopathic medicine is completely safe for any disease, and it takes long only if you are taking in later stages of your disease. Like अगर आपकी pathological changes हो चुके हैं या फिर आप बहुत late treatment start कर रहे हैं तभी वो late काम करती है. वरना if you are taking in
Mm-hmm.
initial stages, it will give you relief
Mm-hmm.
very fast.
Okay. And there is one, Mr. Saurabh, who's asking who gets asthma. Saurabh, if you can elaborate your question, that will be very helpful. What do you exactly mean by that? And then I'll come back to your question. In the meanwhile, I'll take another question. Is it always mandatory to consult homeopathic doctor for asthma medicine, or can you tell me some medicine about it?
It is better to consult a homeopathic doctor because if your doctor will take your whole case, and then only he or she can prescribe you a matlab a simillimum which will cover all your symptoms and permanently cure you. If you
Mm-hmm.
I'm telling you here right now, it will give you, it will only palliate the symptoms and it will
Mm-hmm.
not permanently cure. So better to take a consultation with your homeopathic doctor.
So is it like it is different medicine for different people, taking like looking into their symptoms, age
Yeah.
factor, and everything? So the dosage and the medicine.
For a Yeah, it will be individualized for one person. Your
Okay,
homeopathic medicine will only be suited.
okay, okay. Doctor, there is one more question. Question, that is asthma reversible?
So if you are taking treatment in initial stages of disease and there is no pathological changes yet, it can definitely be reversed.
Okay, fine. And doctor, another question, Mr. Shivam, I think your question has been answered already. That can we cure asthma permanently? That Dr. Pishwani has already answered. If you have any further question to it, you can tell us. And there is one more question, Dr. Pishwani, where the person is asking, at what age asthma could start?
So asthma can start as early as 5 to 6 years of age, and it will progress
Mm-hmm.
in later stages of life. And you should start
Okay.
any treatment in initial stages only.
Okay. And there is one Mr. Vindhyachal Pandey who is asking, homeopathy is really good for this type of chronic disease. Is it good?
It is good. Yeah, it is good for any type of chronic disease. Asthma is
Mm-hmm.
also cured and reversed by homeopathy, and any type of chronic disease that you are looking for, it will be cured by.
Okay. So doctor, is it like homeopathy is only for chronic diseases? अगर मुझे कोई acute illness है, like जैसे अगर मुझे fever है या मेरी normal cold है, तो उसमें क्या homeopathy काम नहीं करती है?
डेफिनेटली करती है. अगर आप इवन इफ यू आर सफरिंग फ्रॉम कफ और फीवर विद इन 2 days और सिंस 2 to 3 days, it will give you relief
Mm-hmm.
within 1 2 to 3 hours. It works that fast.
Okay.
It works in
Doctor,
acute
somebody's
diseases
asked.
also.
Okay. So that is something actually interesting to know that normal acute disease can also be treated by homeopathy. I hope it will be useful for my users. Let me know, was this useful, that क्योंकि मुझे नहीं पता था कि acute diseases भी treat हो जाती हैं homeopathy से. So I would want to know it from my viewers कि क्या होती है. Where do you practice? So it's so Doctor
So
Vaishwani is at Mayur Vihar's store of ours, a center of ours, and all our location details are there available on our Facebook page, and with the doctors. So, can children suffer from this condition too? There is another question, Dr. Vaishwani.
yeah, definitely. In children, there is very prevalent. This disease is very prevalent nowadays, and cough variant asthma
Mm-hmm.
is most common in.
Okay, okay. So I think for now I have finished all my questions. I think there's one more new question. Who gets asthma the most? Okay, that is Mr. Saurabh. I had asked him to repeat the question. So like I think Mr. Saurabh, you're trying to ask me ki, who are more prone to asthma, right? If I'm not wrong, it just confirm it to me. I think he's trying to ask what kind of people are more prone to asthma.
So this condition can be genetic also, and the people who work
Mm-hmm.
in
Mm-hmm.
smoke factories and these things, they are more prone to asthma.
If something else. Thank you, Mr. Arijit, that you found it very useful. We have almost finished all our questions. So, guys, before we wind up the session, I would just inform you all that as I told you yesterday also, that we'll be coming every day for the live sessions with one of our experts, and we'll be having various topics every day. And you all can connect with us on the same time. 4 o'clock will be available, and the topics will be told on our page every day. And if you want any other new topic, please let us know about it. And still, if there are any questions, if you join later on and we have stopped the video, you can still leave the comments or your questions, and our doctor will definitely answer those. Any final instruction to the patients during this time, Dr. Vaishwani, so that people can be safe and keep themselves safe during this time?
So please get double vaccinated and do not leave your house if it is very necessary. Always use a mask and sanitizer and keep your safe distance from people.
Okay. So for the tomorrow, I have got the topic just now from my team that tomorrow we'll be having a session on anxiety and stress management. So all of you can join us tomorrow at the same time with a different doctor, with another expert of ours. Thank you so much, Dr. Parishwani, for your valuable time. And it was
So much,
definitely a
Simran.
very informative session. Uh, and a lot of people are saying thanks to you. So you can
Thank you
say
so
anything
much.
you want to say back to them.
Thank you
Okay,
so much, everyone.
everybody, we'll just finish on Speak to our Doctor.